Get you some answers about this virus. We're joined on the phone as usual. Dr. Erika Hamilton, a microbiologist from UMass Amherst. Hello, Dr. Hamilton. Hope you're well on this Tuesday.
I am, and I hope you are too.
I am, and thank you for asking. We have some good questions for you today. The first one comes from one of our viewers, April G., and it goes, if after 10 days you still have certain symptoms such as no taste or smell, should you be retested before returning to work?
Not necessarily. It rather depends on what the symptoms are. So the CDC has some pretty specific guidelines about when you can return to work or when you can start going back outside again. And you need to wait at least 3 days after the last day of when you have had a fever. So you've been fever-free without the fever-reducing medications for 3 days. It's been at least a week since the onset of your symptoms. And most of the rest of your symptoms have gone away, such as a cough or feeling lethargic. The loss of taste and smell is a little bit different. It seems that in about 3/4 of people who have this symptom, it takes 2 to 4 weeks for their sense of smell and their sense of taste to come back. In the last quarter of patients, and this is really kind of sad, their sense isn't coming back, or it's not coming back completely. It doesn't mean that you're still infectious. It means that some of the inflammation that happened in your nose may have done some damage to some of the nerves that sense smell molecules or odor molecules. And we don't know, or no one knows, how long this loss of the sense of smell and taste is going to last for these few people who've not gained it back yet.
Wow, that's a bit discouraging. My jaw dropped a bit hearing you describe that. So something to monitor, no doubt. Wow. Oh, okay, so the next question goes, and this is a big concern right now, COVID-19 related. What problems could come from the protests and demonstrations we've been seeing across the country? A lot of people getting together.
Yes, and a lot of the protests have also happened at the same time that a lot of states are ramping up reopening. We will see spikes in cases. It will vary depending on what state or what city you're in. It will be very difficult to tell whether it was due to a protest or whether it was due to the reopening of the state. But it is something that places are going to have to prepare for within 2 to 4 weeks, having more people with COVID-19. If you do choose to go to a protest, remember to bring your hand sanitizer. Remember to wear a mask. If people are sharing food, and drink, maybe don't do that. Maybe bring your own instead of sharing with other people. If you are a high-risk person, really consider doing something other than a protest to keep yourself safe. And if you do go and you have someone at home who is high risk, when you come home, take off your clothes, wash them, take a shower before you go near the person who is high risk.
I mean, that's almost what social media could be for those who are at a higher risk. Maybe just do it virtually, avoid the issue there. Okay, so the final question we have for you today has to do with, I believe it would be heart-related in the end. Are we learning more about COVID-19's impact on blood vessels? Like, how serious can such a thing be?
It's actually very serious for some patients. What they started to find about a month or two ago is that in some patients who had died, in their autopsies, doctors were finding blood clots all over patients' bodies, or 1 or 2 large blood clots, say, in the brain. And what's happening is that COVID-19 can not only infect your respiratory system, but if it gets into your blood system, it can actually infect the cells that line your blood vessels. And when they do this, they cause a massive amount of inflammation to happen, and this inflammation leads to blood clotting, which of course is very dangerous. It can cause a whole host of problems, including heart attacks, strokes, and pulmonary embolism. So it's very dangerous. Now, in patients where this has happened and have been treated for it, it is unknown how long the damage will last for, or if there will be some type of long-term circulatory clotting problem left over from COVID-19.
Almost with the sense of smell and taste. Dr. Erika Hamilton, thank you. As we no doubt learn more about this virus, we'll have you on to answer our questions about this ongoing global pandemic. Stay well, all right? 12:30, folks, ABC 40 right here. Tune in.